Hello everyone, my name is Brennan Lawhorn Moore, and I'm here to show my presentation, my video pitch on MedFlow, which is a streamlined interface. All right. So a little bit about MedFlow. So MedFlow is a light, streamlined interface that aims to enhance the speed and actual patient data entry for medical staff. Most medical professionals have to work with either an outdated or incomprehensibly complicated electronic health record systems, or for short EHR systems. This can lead to a slower workflow and higher rates of documentation errors. MedFlow solves these problems with a simplified, intrusive interface that boasts for fast loading times, clear input fields, and instant analytics. This system enhances clinical efficiency, reduces data entry mistakes, and ultimately improves the quality of patient care. With MedFlow, one can see just how much better design, not more complex, can truly advance healthcare. So, a little bit of the app and system, app/system. MedFlow is a web-based application that allows medical persona to enter and review patient data, such as vital signs, demographics, and clinical notes, solving the problems brought about by current multi-screen, slow, or imperfectly designed interfaces that cause inefficiency and waste time in clinical tasks. So, some problems that MedFlow solves: slow and cluttered EHR interfaces, boom, gone. Frequencies, entry mistakes, boom, gone. Long staff training times, boom, gone. Poor usability in fast-paced medical environments, boom, gone. So how will we solve this? We will have a cleaner face with only essential fields, fast responsive UI, instant analytics for quality checks, simplified workflow that reduces the errors. All right. Oh, the wrong button. So market segment. So our primary market is to look out for the hospital and clinics, no matter how big, how small, nurses, CNAs, MAs, and front desk medical staff, intake staff, or they'll be called techs. Urgent care and emergency departments. So just some secondary market that MedFlow could also help. Just to expand it on, you can have private practices, telehealth providers, home healthcare agencies, and medical schools. So my persona, so let's say we have someone like an RN named Alex. So we're gonna meet Alex here. He's age 28. He's an RN. Alex works in a busy outpatient clinic where patients' volume is high. They often struggle with slow EHRs systems and repetitive entry tasks. Alex needs a tool that is fast, simple, and efficient so they can spend more time with patients and less time fighting these software. I should have added on, because Alex can't just be like, "Oh, I want this, want that." So Alex goes talks to the head people of his network, and the head people suggests yes. I think we've been getting too many complaints about it, yada yada yada, and the and we show up and we say, all right, MedFlow is the next step into advancing your interface. So how we will help that is being able to reduce documentation time, ensure actually input with fewer steps, provide quick access to previous entries, and minimize frustration with peak clinical hours. And just some financial analysis. So the minimal development tools are free. So what I've been using is like HTML, CSS, JavaScript, Node.js. All this is downloadable on the internet or even in Microsoft Studio to be able to download. Some benefits: we get a faster staff workflows, fewer data entries, reduced training time with new hires. Intangible benefits: higher staff satisfaction, better patient experience, improved operational efficiency. And the ROI would be healthcare facilities can save thousands annually and say and staff labor time reduces alone by improving documentation efficiency. So Moscow analysis. This is just like part one of it. So I must have a functional login, which can include with having great security, having a good login. Nothing can be able to breach that because this is all patient data, and we do not want that to have breach. Have a patient data entry form. So when they first get there, have a data form ready for them, ready to go. Uh, Location database storage, analysis display, and clean UI with some tabs. Should have medical databases entries, settings, saving features, and basic error messages. This is part two of it. Could have a dark and or light theme export reports to like PDF or from other like hospitals and stuff like that. Multi-user login roles. What I will not have or won't have yet is a full hospital level EHR interrogation as of now. HIPAA, complaint cloud development, and patient chart visualization. So really, the biggest thing is HIPAA. I mean, you can't really like get real patient data from anybody, so it's probably never gonna happen. Implement pen. Um, phase one interface and forms completed. Login, patient entry, and medication, and a navigation tab. That's why I asked completed. Also, just backend interrogation that I completed. Server.js, SQLite setup, routes for data entry and retrieval. Next plan next is to be able to improve UI and settings, save user preference, improve medical occasions. Future enhancements is to have cloud hosting, which means like storing the data as so far. Role-based logins, and advanced reporting. For the future, so I think for my interface, Medflow's next step is to evolve from a prototype into a fully operational clinical intake system, which plans enhancements include complete data visualization, additional analytics visualization, improved medication management, exportable patient summaries, and develops to secure environment. So what I have so far here, I can show you. So just like this is the login. As of right now, I don't have anything that could switch the tabs yet, but I am working on figuring that out pretty soon. But if I would hit login here, you know, the login would take me to Medflow main, which is this one right here. So this is Medflow main. So this is everything that we are gonna have. So this is the main dashboard. I'm working on trying to get this just to be this, and then these to be tabs right here, just these to be tabs right here, and just have this on the main menu. So this is where you put in the patient time entry. This is the cloud-based data I was talking about, having a more back-end database to like a cloud, able to save all these data that I would put in. Make it easier. You can put in like your birthday. I just put a little tab in there, just to find it. You can go, 30 years and find, which was a little bit faster, but you can just find your year. Here's my settings. So light and dark theme is already on here. Um, I wish the says it's sending this page, but one until I can get like a local host for for just like the interface, then I can easily be able to switch this to a black to a dark theme. Just the medication part, just dosage and stuff like that, patient entry, and then also working on when you hit patient entry, instead of this being here, this will be over here, and then it will be able to show me all the analytical data that I have put through the system and what everybody's like, what are changing, what is this, what is that, to just find it way, way more easier. And let's say you come from a different hospital, your thing will load up right here because they already have your data. So that's it for so far. I mean, I can show some of my code that I've been going through. I've been using JavaScript. I've been using HTML a lot. HTML is the biggest part. Script, server, JavaScript is probably going to be the biggest thing just to make my interface even function, like more, not functional, but like more better, more functional, way more smoother and cleaner. Um, and I mean, that's it. That's all I have for my pitch. Hope y'all enjoyed. Appreciate you.